Greetings and welcome to the Cancer Interviews podcast. I'm your host, Bruce Morton. You know, there are many different types of cancer, and for each of them, there are different sorts of treatment options. But we can agree that a lot has changed in how cancer has been treated since 1985. But that was the year our guest was diagnosed with breast cancer. She is Liza Fues of Bethesda, Maryland, and she's going to share with us her cancer journey and the ways in which treatment of breast cancer has evolved since 1985. So now let's get started. And Liza, welcome to Cancer Interviews.
Thanks so much, Bruce. I'm happy to be here.
Now, it is our custom on Cancer Interviews that we like to learn a little bit more about our guests. So if you would, tell us a little bit about where you're from, what you do for work, and what you like to do when you're not working.
I am married, have two daughters who are both in their 20s. One is graduated college and is out working, and the other is a senior this year. For work, I am a technical assistance coordinator at the George Washington University Cancer Center. I work on an award from the Centers for Disease Control and Prevention that funds our support of comprehensive cancer control departments across the country. And when I'm not working, I really love theater, and the DC area is a great place for that. I also do a lot of cancer advocacy in that area as well.
Now, I'm somebody who knows a little tiny bit about Western Pennsylvania, having lived there for a time. And you mentioned you're from Pittsburgh, so it sounds like you have lost your accent.
I am told that I've never had an accent. My mother is from the Bronx, and I think her accent tempered the development of my Western Pennsylvania accent.
Now, let's talk about your life prior to your being diagnosed. You were diagnosed in 1985, but there was a time in, say, 1983 or 84 when cancer wasn't a part of your life. What was your life then? What were you doing? And how was your health?
So my health was great. I was only a couple years out of college, and I went to college at Northwestern University, loved it. I actually stayed there for 1 year. But after that many snowy winters, I was ready for a switch and chose to move to Dallas because my best friend from high school lived there at that point and had been there and was working. So I moved to Dallas. I was working in the human resources department of what was then a Big 8 accounting firm, and was really sort of off on my own, being independent for the first time since college.
Now, before we go any farther, we'd like to remind you that on Cancer Interviews, we do not provide medical information. And if you need that, please consult with a licensed healthcare professional. So now your life has changed. You moved from Evanston, Illinois to Dallas, Texas. Your winters are a little bit warmer. And at some point when you were down there, Liza, I'm guessing that you learned that something wasn't quite right. Describe what that sequence was like when you learned that something might not be normal.
Yes. Well, first I have to refer back to my Northwestern experience. I visited the infirmary for a routine matter, and luckily someone there taught me to do breast self-exams. Now, at that point, I was probably 20, and I certainly wasn't regularly doing breast self-exams. But one day in 1985, I did one, just randomly, and I did find a lump. And I went to my gynecologist and encountered my second piece of luck because he had me wait 30 days and then come back for a recheck. And when the lump was still there, he at that point sent me directly to a breast surgeon. And I say I was lucky because given my age and given the fact that there was no family history, his choosing to send me on to a surgeon rather than wait longer was remarkable. So that was the initiation of the sequence of events.
Now, this is quite a few years later, but you sound as though you were rather calm through this entire chain of events.
again, just going along with the being lucky theme, I had mentioned my friend who lived in Dallas, who was a nurse at Baylor University Medical Center. Her uncle was a physician there and had been a physician there for many years. And when we found the lump, we of course spoke to him, and he really put together my medical team of a breast surgeon, a plastic surgeon, and an oncologist. And I felt that I was in really good hands with his involvement and the people who were taking care of me. I really sort of trusted the process, and being very young and feeling, subconsciously that feeling of invincibility that 20 some people have. I think it all came together and ended up not causing as much distress as one might expect.
Now, today, there are many ways to learn about the cancer that you have or the cancer you may have. Those options, I'm guessing, did not exist in 1985, or if they did, it's a small fraction of what's available and what's out there today.
Yeah, I mean, for the original biopsy, it is 35 years ago, but I don't believe I was offered any options at that point. The other issue was that they knew that this tumor was rather large. At this point, we were calling it a mass, not a tumor. But it was rather large. And so my surgeon decided to proceed with a surgical biopsy, keeping in mind that they really thought that this wasn't going to be anything worrisome. I think that the thinking was we would go in, do a surgical biopsy, and that would probably be it for any treatment necessary.
Now, you had mentioned your very good friend and her uncle. I am guessing that between the two of them, consciously or subconsciously, they formed sort of a calming influence for you.
They were. I had tremendous support. I mean, from them in Dallas, from friends in Dallas. My family was primarily in Pittsburgh, and down the road when we did get to chemo, my mom luckily was able to fly down every month for 6 months. So I had a lot of support.
Now, one thing that we've learned at our end with these interviews from people who have undergone chemo, that it's never pleasant, but it affects different people to different extents. Describe how chemo affected you. How acute was the effect on you, and what were things that you had to do as part of the regimen, and what were things you couldn't do in terms of your day-to-day life?
Well, to start with the first question, I mean, it made me really sick, which we knew it would. The drug regimen that I had, one of my doctors, his favorite word was rigorous. So it was a rigorous cocktail of drugs that I had. So what we would do is I would have my treatment on a Friday once a month, and then I would be pretty much sick until into the next day, into Saturday, maybe afternoon. I'd start feeling better by Saturday evening, would rest up Sunday, and then I was able to go back to work Monday. Again, the benefit of being 25 and healthy and having, overall a pretty good immune system. And that lasted for 6 months.
Okay, now one of the things that happens often with chemo is hair loss. And one might say that it perhaps can be more traumatic for women than for men. Was it traumatic for you? What was the extent of the hair loss, and how did you deal with it?
I will say that was traumatic, and I was surprised. But you grow up with your face, right? You know how you look every day for your whole life. And when you have no hair, because I lost all hair on my head. I didn't lose it everywhere on my body, but I did lose pretty much all the hair on my head. It was really a shock. But again, with my trusted buddy, we went to a wig store, and I'm naturally a brunette. We tried on every color wig that they had. I thought it would be fun to be blonde. My complexion sadly did not allow for that. It was not flattering. I ended up with an auburn wig, which was just lovely. So that was fun. And I will say, okay, like just humor me here, keeping in mind I was 25. During the time that this was all happening, over those 6 months from 1985 to 1986, a very edgy club, I think it was called the Start Club, opened up in Dallas. Not the kind of place I would normally be cool enough to think about going to, but as a woman with no hair, when we got up to that waiting line with the red velvet, I left my wig in the car. The bouncer took one look at me and said, he said, how many people are with you? Come on in. So there was my silver lining for hair loss.
Now, one of the other effects of chemo can be loss of taste and or appetite. To what extent did that affect you?
With my first round, because I was diagnosed initially in 1985, as we've been talking about, but then I was diagnosed with a second primary breast cancer 5 years later. And the side effects were different. The first time I had heartburn virtually nonstop. So for the time I was on chemotherapy, I ate a very bland diet. I had a lot of plain pasta. Just about anything would set off the heartburn. So it wasn't even so much that I didn't have an appetite. It was just that if I ate, I would get tremendous heartburn. So I lost a lot of weight with the first regimen.
And when you got to the second regimen, in a sense, were you better positioned to deal with it because you'd gone through it once, or was there this additional layer of dread because you knew what you were going to be going through?
Both. I would say both in equal measures. And I thought, oh, I'm so well prepared. I went out, I bought a wig. I thought, oh, I'm going to lose a little weight. I did not lose my hair. And this time, instead of heartburn, I had low-grade nausea the whole time, and I ate constantly. I was always eating saltine crackers, so I gained weight. So much for being prepared.
This almost sounds like choosing your poison, but as one who experienced both in heavy dosages, which is worse, heartburn or nausea?
I'm going to go with the nausea.
And so we talked about hair loss and the lack of, in some cases, appetite. When you were going through chemo, what were some of the things you couldn't do that you would otherwise do in a pre-chemo world?
Ooh, I think the only thing I can really think of, I mean, other than that sort of lost weekend immediately after my chemo, I actually had a Hickman catheter implanted for the chemo treatment, as opposed to using the veins in my arms, because I have tiny, thin veins, and they were not gonna do it for chemo. If you're not familiar with what that is, the catheter is implanted. I believe it goes into a large vein in the chest, and there's actually the end of the catheter is external. And so when it's time for chemo, there was a clear dressing. They would remove the dressing, take the catheter tip, and that's where they would insert the needle for the treatment. So because of that dressing that was on my chest, something like swimming was not possible for the period of time that I had the catheter. And there was certainly a little more fatigue, but I'm not, a mountain climbing type of person. Not that there are mountains in Dallas, but I honestly, and again, it's been so long, I don't remember anything else specific that was really foreclosed while I was on chemo.
Our guest is Liza Fues of Bethesda, Maryland, who was originally diagnosed with breast cancer in 1985. By the way, if you like what you hear on this segment, we invite you to subscribe to our podcast by clicking the links below. Once there, you will see a bell icon, and if you click on that, we will notify you anytime we post a new interview. Now, Liza, getting back to your cancer journey, in addition to your good friend and your parents, and perhaps by extension, your friend's uncle, who was part of your medical team, was there any other source of support for you that helped you get through this?
Yeah, there actually was. I met a few other young cancer survivors, primarily through my doctors. And I tried a support group at the hospital that was initially recommended by one of my doctors, but I went to the meetings twice, I think. And I was the youngest person in the room by decades. I was 25. So the other two young people that I met who had cancer, we sort of banded together and we formed a support group for young people. And we were able to meet with folks from the American Cancer Society, and they supported us, in the effort, and arranged to have a social worker facilitate the meetings. So we weren't just, lay people who really didn't have any training trying to shepherd along a group like that. And it was very useful, to have young people to talk to, because I found it was a lot easier to talk about sort of the darker side of your worries about cancer with strangers, with sort of disinterested third parties, as opposed to talking to my mom about that. She is not the person I wanted to talk to about that stuff. So I think we all found that really helpful.
Okay, now there had to reach a point in which you felt that you were starting to get the upper hand on cancer. Describe what that was like. I would have to think that was a source of encouragement, to think that you're close to getting over the hill.
You're talking specifically about during the first.
I would say
the first treatment period?
The second. I would say after the second diagnosis.
Second. Yeah, I think that the factor that most plays into that is the amount of time that passes. Because cancer survivors all know that when you immediately finish treatment, you're still being checked fairly frequently. You've got those oncologist appointments, and you go in maybe every 3 months, and then it stretches to every 6 months, and then you get to once a year. And I was at once a year for many years. And finally, at some point, by this time I had moved. We had left Dallas, and we were in the DC area. And the oncologist I was seeing, who had no part in any of my active treatment because it's been so many years, he finally said to me, Lisa, I'm not doing anything for you. You come in, I'm happy to see you. We do a lab workup, we check your blood. But he said, really, we don't have to do this every year. And at that point, I sort of felt, oh, this is good. This is encouraging that my oncologist is firing me. So that was probably when it was most apparent to me.
And was your feeling one of relief, or being elated, or a little of both, something in between?
Definitely something in between, because I do think that, again, I think this is experienced by a lot of survivors, that while you're in active treatment, you feel like you're doing something. The medical folks who you're working with have their eyes on you. And it's sort of a layer of protection. So being cut loose, I think, also has its scary moments, which is why I know that today, often, or sometimes, I guess, depending on where you are, survivors receive a survivorship care plan, sort of a roadmap as to which tests they need and at what frequency, and hopefully which medical provider will follow up on each of those tests. That didn't exist in 1985 or 1990. So, I think certainly that makes you nervous. But as I said, time goes on, and that's what you do.
So let me ask, in terms of what you do, in terms of your physical life now, how close are you in terms of what you can do to say how you were pre-diagnosis, before your first diagnosis, how much of what you could do then can you do now?
I'm 60 now, and I was 25 then. So we have to take that into consideration. The one thing that my plastic surgeon told me before my initial mastectomy and reconstruction, the reconstruction that he chose to do at that time in 1985 was latissimus dorsi, where it's called a backflap, where they made an incision on my back, cut away, resected a part of the latissimus muscle, tunneled it under the skin, and anchored it in the front to provide a new blood supply to the reconstructed breast. So what my plastic surgeon told me was, after this, you're not going to be able to climb hand over hand up a rope. Since I had never done that, it wasn't a big problem for me. Other than that, I can't really think of anything that I'm really not able to do specifically because of the surgery.
Now, you had mentioned reconstruction. Was that the plan all along, or were you sort of on the fence as to whether to go that route?
I have to say, given that I was very young, I felt like I had good doctors. I felt like I had good advice, and I did not question a lot of what was happening. And my plastic surgeon said to me, "You are 25 years old." He said, "It is rigorous to do the mastectomy and the full reconstruction in one surgery, but you are young. You are going to heal well. And that's what I suggest." And I said, "Okay, fine." So that was always the plan.
Now, two other questions I want to ask you, Liza. And the first one is, you had mentioned briefly that you are a cancer advocate. Exactly what does that entail? When you interact with somebody in your capacity as an advocate, describe what that interaction is like, what it entails.
Well, it's evolved. It's definitely evolved over the years. When I was initially diagnosed and I was hospitalized for my surgery in 1985, it's hard to imagine this, but I was in the hospital for 8 days. And the American Cancer Society had a program then, it still continues today, called Reach to Recovery. And at that time, because people were in the hospital for so much longer, a woman who had also been through, a breast cancer diagnosis and surgery would actually visit a newly diagnosed patient and bring some information, some pamphlets, some very simple exercises to do after surgery to help with range of movement. And I was so impressed by the woman who came to visit me that I became a Reach to Recovery volunteer. And I did that for a number of years. And as I moved to different places, I went from Dallas to Chicago to Washington, D.C. I stayed as an American Cancer Society volunteer in different capacities. Once I had my kids, we started doing an American Cancer Society event together called Relay for Life, where you put together a team. It's an overnight event where you're walking a track. The idea is that someone from your team is always on the track to mimic the concept that cancer never sleeps. In the last 5 years or so, maybe a little longer, I've moved more into volunteering in the policy area because making a change at the policy level, whether it's local, state, or federal, has such a large impact at a broader level. I also went to law school in the interim, which also spurred some interest in policy. So currently, that's what I'm doing with American Cancer Society and also with the National Coalition for Cancer Survivorship, two fabulous organizations that advocate for cancer patients and survivors.
Okay, along these lines, Liza, I want you to put on your advocate hat and try to enumerate just a few questions that somebody who has been diagnosed or somebody who thinks they might diagnose, questions they should ask today, questions that you would not have thought of in 1985.
I think I would definitely ask about options for, everything, just so you have to me, I think having the information, having a comprehensive understanding is important to me. And again, that might not be the case for everyone, but were I in the situation today, I would ask about options for everything from the biopsy method to the recommended treatment. I think I also would ask about getting a second opinion, not out of distrust for my original physician, but just to make sure I was receiving input from different points of view. And I think the other thing I would probably do would be to do some significant online research with reputable sources, like the National Cancer Institute, like the American Cancer Society, and try to educate myself so I could ask educated questions.
All right, we're going to wrap up now, Liza, and we always start off our interviews from kind of the same point, and we try to end them from the same point from interview to interview. And that is this: you're in an almost unique position as being someone who is in her fourth decade of survivorship, if you will. And against that backdrop, by way not just of education, but inspiration, if you had a private audience with somebody who had just been diagnosed, what would you tell them?
I would tell them that hope is very important. I personally think that it's an equal measure with everything else I would say learn how to ask for help and accept help. The idea when I was 25 of having my mom come visit me every month for 6 months when I was out in my apartment, living independently, was not something I would have, expected having happen, but it was great. So asking for help and accepting help, I think, is crucial. Find things that make you laugh. And if it feels right when you get far enough removed from your personal cancer journey, see if you can give back in any way that feels good to you, whether it is one-on-one support for newly diagnosed, support policy measures that would increase funding for cancer research, any of those kind of ways maybe to be engaged, I think are all terrific.
All right, Liza, thank you very much. Our guest has been Liza Fues of Bethesda, Maryland, who was originally diagnosed with breast cancer in 1985 and went on to be a two-time survivor. Liza, thanks so much for being with us.
Pleasure, Bruce. Thanks for having me.
And again, we want to remind you on Cancer Interviews that as you go through your cancer journey or as you contemplate perhaps going on one, that you are not alone. We are with you every step of the way, as are our various guests who have gone through their cancer journeys themselves. So until next time, this is your host, Bruce Morton, saying take care, and we'll see you on down the road.
Thanks for joining us today. For more information, please visit us online at cancerinterviews.com. We appreciate you tuning in, and we'll see you back here again next time on the Cancer Interviews podcast.